So you wake up in the middle of the night and you have bad toothache and there is no dentist available, there is no chemist nearby. What do? In this video, we'll try to understand some of the available home remedies that you can use in case of an emergency toothache. And more importantly, in the end, I'll tell you some of the things you should absolutely avoid. Hi, this is Dr. Ganesh Prasad from T32 Dental Care, Mangalore. If you want to know how to take care of your teeth and oral health in a better way, please subscribe to the channel. Before I begin, I want to make it very clear that generally I do not recommend self-medication and so-called home remedies, because if you're having toothache, it's your body telling you that you need to see your dentist. I have made a separate video on this topic and the link for it is in the description below. However, here we are talking about home remedies for toothache as an emergency. First, try to determine where the pain is arising from. There could be something stuck between any of your teeth. If that's the case, try to remove it with either an interdental brush or a dental floss. If you do not know what is an interdental brush, I have made a video on that. The link is in the description. If you do not have an interdental brush or if you do not have a floss, you can use a toothpick, which I do not generally recommend, but here we are talking about an emergency. So somehow try to remove if there is something stuck between your teeth. You can also try a water floss if you have, or you can try to rinse it off using plain water or warm salt water. Next, paracetamol. Most of us know that paracetamol is a pain medication, which it is, but most of the people do not know that paracetamol is also an excellent painkiller. The reason I'm talking about paracetamol is that nowadays most of the people keep paracetamol at their homes, and if you have an access to it, provided you have used it in the past for fever and you are not allergic to paracetamol, you can take it as painkiller. Next, look into your first aid kit. By the way, I strongly recommend everyone should keep a first aid kit at their home, and the first aid kit should contain a painkiller such as ibuprofen or any painkiller that your physician recommends you. Make sure you take the right dosage and you are not allergic to it, and do not forget to check the expiry date. Next, cold compressing, that is, take an ice pack or any frozen packet such as one containing green peas and compress it over that area which is causing pain. Sometimes it does reduce pain. Next, only if these things which I already mentioned are not working, for example, you are not able to flush out anything, there is nothing, or if you're not finding any tablet, or if the cold compress is not working, you can try chewing on something like garlic or clove, because sometimes these things work by masking the pain. Remember, if your pain is also associated with severe swelling, which is very evident, and now it's progressing towards your neck, do not wait and rush towards a hospital, because in some cases these things can turn dangerous. After trying all these home remedies, try to grab some sleep, because sleep really helps you to soothe your nerves. Now the most important part, that is what you should not do. Number one, never use tobacco. Some people do use tobacco leaves and put it around the tooth in order to reduce the pain. That can really burn the skin around the tooth. Never do that. Number two, if you have a deep cavity, never try to poke it with a sharp needle or a toothpick, because this can worsen your pain. Number three, if you have a shaky tooth, never try to pull it out, because again it can cause very severe pain and it can also cause very bad bleeding. Number four, do not crush a tablet and try to keep around the tooth, because some of these tablets are very acidic and that can burn the tissues inside your mouth. If you have any doubt regarding this topic or any other topic related to oral health, please put them in the comment box. I'll be glad to answer those. Thank you so much for watching. This is Dr. Ganesh Prasad signing off.